In this video, we demonstrate how to sample blood for blood cultures via venepuncture with a neosafe needle. This is an open system that allows blood culture sampling in young children and neonates from whom the veins are too small to apply a vacuum of a closed system because the veins will collapse. Due to the lower risk at contamination, we recommend changing to a closed system as soon as the veins of the child are large enough to apply vacuum. In normal conditions, there are no bacteria in the blood. However, in case of severe infections, bacteria may be present in the blood and cause bloodstream infections. To identify these bacteria, blood is sampled in a blood culture bottle and cultured in a liquid medium. However, bacteria are also present on the human skin and in the environment. If these bacteria enter the blood culture bottle during sampling, the blood culture bottle will be contaminated with bacteria that do not originate from the patient's blood. These bacteria will multiply during the incubation and cause false positive results. To avoid blood culture contamination and obtain good quality results, blood must be sampled according to specific blood culture sampling procedures which are demonstrated in this video. In neonates, signs and symptoms of bloodstream infection are non-specific. For blood culture sampling indications, we therefore refer to our procedure in which we list danger signs associated with severe neonatal infections, signs of severe bacterial infection, and perinatal risk factors for neonatal sepsis as indications for blood culture sampling. To sample a blood culture, you need a blood culture request form, a permanent marker and a pen, an alcohol-based hand rub, and minimum 1 pair of non-sterile gloves. For disinfection, you need a timer, 5 dry compresses per blood culture set, and 2 disinfectants. We prefer to use 70% isopropyl alcohol for the first step of skin disinfection and disinfection of the blood culture bottle and holder, and to use 2% chlorhexidine gluconate in 70% isopropyl alcohol as a second step for skin disinfection. For blood culture sampling, you need a tourniquet, you need a neosafe needle, a sterile 2 ml syringe, a 23 gauge needle. Finally, we need a rack for blood culture bottles and a rack to hold the syringe, a dry, non-sterile compress to stop the bleeding after venepuncture, and a band-aid, a sharps container, and a biohazard container. We strongly recommend positioning of all materials at the side of the dominant hand to avoid crossover of the arms during the procedure. Once you have arranged your workplace, you can start the procedure. Check if the blood culture is not expired. Then check the patient's identity by asking his name, age and gender. Indicate your volume of blood you need to sample per blood culture bottle. Inform the patient or his caretaker about the procedure while you disinfect your hands with alcohol-based hand rub before you touch the patient. Position the patient and look for an appropriate venepuncture site. Clean the patient's skin at the puncture site with 70% isopropyl alcohol. Apply vigorous friction. If the wipe is visibly soiled, repeat with another wipe until the wipe is clean. Wait for 30 seconds to 1 minute to allow the alcohol to dry. Meanwhile, you can remove the caps from the blood culture bottles and place the bottles in a rack. Disinfect with 70% isopropyl alcohol the rubber septum of each bottle. Now disinfect the puncture site again with 2% chlorhexidine gluconate in 70% isopropyl alcohol. Apply vigorous friction again and wait 30 seconds to 1 minute to allow the alcohol to dry. Do not touch the puncture site anymore during the rest of the procedure. Disinfect your hands with alcohol-based hand rub. Put on gloves. Unwrap a 2 ml syringe and a 23 gauge needle from their package. Attach the capped needle to the syringe in a sterile way. Remove the plunger from the syringe without touching the wings or now open side from the syringe and throw the plunger away. Do not yet uncap the needle. Place the syringe in a rack and make sure nothing touches the open side or the inside of the syringe. If you want to use a tourniquet, fasten it now. Open the package of the NeoSafe needle and leave the needle in the package to keep it sterile. Take the NeoSafe needle and hold the wing of the NeoSafe needle between your thumb and index finger. Take a dry sterile compress and put it on the skin, just below the puncture site. Puncture the vein with the needle. Do not touch the needle or puncture site. If you have touched the puncture site, repeat antisepsis before proceeding. If your venepuncture fails, use a new sterile needle and venepuncture site and repeat the procedure from antisepsis onwards. Take the 2 ml open syringe with attached needle from the rack. Hold the syringe in such a way that you can still read the volume graduation. Let the blood drop into the open syringe while you prevent that the open side of the syringe or the inside of the syringe touches the skin or the needle. Collect the volume indicated according to the age of the patient. If you have used a tourniquet, do not forget to release it once the blood starts flowing. Place the filled syringe in a rack, but do not reattach the plunger to the syringe. If necessary, you can now take other blood samples for additional laboratory analysis. Remove the NeoSafe needle from the puncture site. Discard the used NeoSafe needle directly in the sharps container and take a dry compress to press it on the puncture site. Ask the parent or caretaker to continue to press and put a band-aid on the puncture site. Take the blood-filled syringe with the attached needle from the rack. Uncap the needle carefully. Next, inoculate the blood culture bottle. Make sure the blood culture bottle is put in a rack and never hold the blood culture bottle by hand when you inoculate it. Carefully puncture the septum of the blood culture bottle with the needle. Wait until the syringe is empty. Once empty, remove the syringe and needle from the blood culture bottle and throw them directly in the sharps container. Take the blood culture bottle out of the rack, mix the bottle gently by inverting it several times and put it back in the rack. Remove your gloves and disinfect your hands with alcohol-based hand rub. Identify now the blood culture bottles with the patient's name, the patient hospital number, the date and time of blood collection, and the sampling site. Complete now the blood culture request form with the date and time of sampling, the type of bottles, your initials and any relevant comment. Peel off the barcodes of the blood culture bottles and paste them on the request form. Check if the bottles are labeled correctly and transport the bottles immediately to the laboratory. Keep the transport time as short as possible and maximum 4 hours. If the transport is not immediate, keep the blood culture bottles in the dark and at room temperature and never store them in the fridge.